So I think the most important aspect of patient care is communication. Communication with the patient and their family so that when they leave an interaction with me, they have a full understanding of the problem, what it is that I'm trying to help with, understand that many times there's choices involved in their treatment and that there are shades of gray. Some approaches have advantages and disadvantages, and I want them to be fully informed. And then beyond that, communication with the other treating physicians. So at a place like MUSC, most of the patients that I will see will be referred from other specialists in my area, or surgeons or internists. And I want the entire care team for that patient and their family to understand what my approach will be for that individual. My principal area of interest is in pancreatitis and other pancreatic disorders such as pancreatic cancer, cholangiocarcinoma, which is a cancer of the bile ducts, as well as other disorders of the biliary tree, which is the system that connects the liver to the small intestine. So when a patient comes to see me, they're not just seeing me as an individual. My team involves nurses that have been taking care of patients with complex disorders for many years. It involves a surgical group that's also expert in their discipline at taking care of patients with the similar disorders, and a variety of other specialists so that when you come to my clinic, you can assume that I will be counseling with surgeons, with radiologists, with pathologists, and a variety of other specialists in a team environment. And we have experts in all of these areas. We can all put our heads together to come up with the best solutions for treating that individual. So every patient is unique, and no approach for one person may be the same for another. And so this is why another focus of my practice, in addition to clinical care, is research, in clinical research, so that we will not only consider patients for treatment, but we also would like to consider them for studies to decide how can we do better in taking care of patients going forward, achieve better outcomes, perhaps achieve an excellent outcome, but do it with less intervention, less discomfort and inconvenience for the patient. And so staying abreast of all the most recent research in the area that I practice, attending national meetings, presenting at national meetings, having friends and colleagues who are also considered top tier in my area, and I bring that to the patient to the table and consider them also to participate in research studies that will change the practice of medicine in the coming decades.